The most common symptom is pain in the right upper quadrant underneath the ribs on the right side that radiates towards your back, towards your scapula. And again, it's usually associated with taking fatty foods. It's associated with nausea, occasionally vomiting. And if you get sick enough, obviously you start getting fever, and it could be a pretty significant disease. The gallbladder functions as a storage, so we can remove the gallbladder because the bile is really produced by the liver. So normally what happens is while you're not eating, that bile goes into the gallbladder and waits for you to eat. Once you remove the gallbladder, the bile goes directly into the small intestine, and your body ends up adjusting, reabsorbing more of that bile. So you really don't miss your gallbladder. The causes of gallbladder disease is mostly stones in the gallbladder. Once your gallbladder starts developing stones, and we don't know why that happens, but once the process starts and you become symptomatic, which is usually pain in the right upper quadrant that has radiation to the back, associated with fatty food intolerance. So people will often come to see me with pain that's related to eating fatty foods. So once we make the diagnosis of gallstones, the reason you need surgery is because sooner or later you're going to have an emergency where a stone gets stuck in the outlet of the gallbladder. So the evolution of the gallbladder was it used to be a huge incision in the right lower quadrant or in the midline of your abdomen that slowly evolved to a smaller incision until laparoscopy was invented. So laparoscopy gave us the tools to be able to operate from the outside through minimally invasive through little holes. Robotic has taken it a little step further in that the magnification, again, the visuals are so much superior, and the instrumentations have improved to the point where not only do we do it through small incisions, we do it through one small incision that's in the belly button, and we can hide that incision. So cosmetically, it's preferred, and again, you're going from 4 incisions to 1 single incision. The treatment options are surgical. There's no real good medical treatments. So once you start becoming symptomatic, you pretty much have to have your gallbladder removed. The surgery, most people can be done as an outpatient. So they come in, have their procedure, they recover for a couple hours, and they can go home. At most, some people stay overnight because they may have a little bit of nausea after the surgery, so we keep them to make sure they can go. The recovery has been tremendously different from the point of pain. It used to be a very painful procedure to have your gallbladder removed. Now it's an outpatient procedure. Even the small incisions, we block them with anesthetic, so when you wake up, you're pretty relieved.